Hello students, welcome to the discussion on Paripurna and today we shall be discussing five topics of 17th November. So one topic we will be discussing the mains lens and four will be prelims related topics. So the topic of mains lens is very important topic for today because UPSC can ask question on this line itself. No, the topic says where does India stand in tackling TB? Or no, UPSC can rephrase it and UPSC can ask that no, why still India is not able to reach the TB elimination target of 2025. So UPSC can ask question in any form. So first of all, let's discuss this topic is relevant for which subjects. So you can relate it with GS paper 2, that is the topic of health, or you can relate with GS paper 1 also, the topic of poverty. No, when we will be discussing this topic in detail, no, you will understand that how poverty is no related with this. Then you can discuss this topic under GS paper 3 also, like no, the topic of diseases or the topic of technology also it can be discussed. And you can discuss on in essay also, any essay related to governance or any essay related to health. Okay, so now we have just discussed the importance of this topic, so please do focus on all the facts and data which I am discussing because no, you can prepare your topic in this discussion only. You don't need to add any other data related to TB, especially if the question is asked on TB. So please focus on this discussion. Okay, it is very important. Now, let's start our topic. So see, the heading says, where does India stand in tackling TB? And the context is related to WHO's global TB report. Okay, so this is the context. Okay, so in this complete discussion, we will be discussing that what is the progress of India in tackling TB, and if India is lagging behind, then why India is lagging behind, means what are the reasons. Okay, so let's discuss. See, first of all, see, I think 2 or 3 days before we have already discussed that India has reduced TB incidence by 21% since 2015. Okay, this we have discussed. But the fact is that still India remains the highest TB burden country. Still highest TB burden country. Okay, this is very important. So now the first question is why did we miss this target? Because no, we set the target of 2025 of TB elimination, but still we are not able to eliminate. So why did we miss our target? Okay, and second most important question is that what are the challenges that India is facing that even the world's largest health program is not able to solve? Because India claims no that we have world's largest healthcare program, right? So what are the challenges India is facing that even this program is not able to no address this TB issue? Okay, so now let's discuss what the article says. So our first heading we will be discussing will be that why TB still matters. Because see, if I am saying that no TB, India is not able to tackle TB or these are the issues or challenges, then I have to substantiate with data, right? For every answer, for every point, you have to provide the substantiation. So if I am saying that no, TB is very big matter or TB is very big issue, then provide the data. So this here is the data. TB continues to be the deadliest infectious disease in the world. This is because we say that TB still matters. Okay. And I think this is the very important data which you can easily remember that India accounts for 25% of global TB cases. 25%. Can you imagine? That means the one-fourth of global TB cases are in India only. So please remember and revise with me only. India accounts for 25% of global TB cases. Okay. And if you want to remember another data, so TB accounted for 1.2 million deaths globally in 2024. So, on the basis of these data and facts, I can say that still TB is important, still TB matters. Okay, now one homework I will give you. You can provide me answer in comment section also, or you can prepare for yourself also. I am saying an important line that TB is a medical condition. Okay, and TB is also a socio-economic condition. Okay, because see, socio-economic condition. Because here, when we were discussing the subjects, no, for which subject TB is important, TB is important. So I discussed GS paper one, poverty. See, poverty is no in GS paper two also. So why I said poverty because of this only. So I said that TB is medical condition and socio-economic condition. Okay. So I think for medical condition, you can easily get the answer. You can no discuss about the microorganism and these all things. But why I am saying that TB is socio-economic condition, please prepare an answer for yourself and please write your answer in comment section so that we can discuss. Okay, so this is the case of TB. Now, let's discuss India's performance because the heading, because we are discussing this only, no, that why India has not improved. So first, let's discuss the India status, right? So question is only saying India's performance, has India improved? Okay. So first of all, we will discuss the improvements. See, for every topic, we will discuss the pros and cons, right? So here we are discussing the progress. So as we already discussed that India witnessed a decline of 21%. Okay. Now I think you will not no forget this data. 21% decline since 2015. And in the previous article, we discussed this thing also that decline in India is almost double the global rate. So this is also very important. Okay. Now, second thing, what is good in India is India recorded 92% treatment coverage. This is very big thing. Means no, 92% is very big thing for treatment coverage because marginalized sections or the tribal sections or the people living in remote areas, these kind of population are not able to get no the this coverage for no any infectious disease. But if treatment coverage is 92%, this is very big thing for India. Okay. Now, third thing, article discusses about the diagnostic revolution. So, what do I mean by this diagnostic revolution? So see, basically article discusses that various types of molecular lab test, okay, have been set up in India. TB diagnostic network have been set up in India. So not much important, but please remember these two, 3 points which I have discussed. Okay. Now, so this was the state of India in positive side. Okay. But negative side we will discuss, don't worry. Okay. So now, if something positive has been happened, so no government initiatives will be responsible. Or obviously, other initiatives will be responsible. So let's discuss some of the government initiatives because of which India was able to reach to this state. Okay. So first of all, very, very important initiative is the National Tuberculosis Elimination Program. Okay, so let's discuss briefly. So this basically this program was launched in 2020. So earlier the name of this program was Revised National TB Control Program. Okay, so then the name came to National Tuberculosis Elimination Program. Okay, so what was the main point of this program was this program has set the goal to eliminate TB by 2025. Okay, and this is the whole point of discussing this article that no why India was not able to reach to its target. Okay, and see the global target was 2030. Sorry, the yes, the global target was 2030, but India had set the target of 2025, which was 5 years ahead of the global target. Okay, so that thing we will discuss that why India was not able to reach to its target. But let's discuss no briefly about government initiatives. Okay, so this National Tuberculosis Elimination Program was launched in 2020. We discussed. Okay, now what all other features were important? So second thing was expanded diagnostic infrastructure. Okay, so what do I mean by diagnostic infrastructure? Means no the infrastructure through which we are able to find out that no what is happening in human body, right? So for TB, very important thing is the rapid molecular testing. Okay, rapid molecular testing. So see, if we are discussing about a particular disease, no, so every disease will have its particular terminology, whether it is related to biology, no, whether it is related to its treatment or anything. So please focus on the points which I am highlighting. This rapid molecular testing in any answer of TB or health, you can write. Okay. So what is this rapid molecular testing? See, it's nothing but no, it finds out the genetic material of TB bacteria. Okay. And if you are able to detect the genetic material of TB bacteria, no, then diagnosis becomes easy and fast also. Okay, so this is the thing, expanded diagnostic infrastructure. Okay, now other thing what we can discuss is the use of technology and AI. Okay, so why I'm saying how the technology can help for TB diagnosis or TB treatment. See, as you know that for TB you will require X-ray equipments. Right. Why we require X-ray equipments? See, as we already discussed that TB affects the functioning of lungs. Right. So we can use X-ray units for pulmonary TB. As we discussed that there is pulmonary TB and second is extrapulmonary TB. So X-ray units you can use. Okay. So in that basis you can do the screening of complete body and you can find out the abnormalities in human body. Okay, so and AI can help in the fast and easy diagnosis, right? Now coming to decentralized TB care. See, whenever you are writing an answer or anything on decentralized healthcare, please do write this Ayushman Arogya Mandirs because government is discussing this Ayushman Arogya Mandir in no every speech or anything related to health. So, decentralized healthcare through Ayushman Arogya Mandirs. So, what they do, no, these for these centers provide the healthcare services closer to communities. For example, no, people who are living in no Bastar region, people who are living in Dantewada forest region. So, these centers are no. Very near to the rural area or very near to the communities so they can easily reach whenever there is an emergency. Okay, no. Now, we discussed this. Now, and this was very important thing, Nikshay Poshan Yojana. Okay, so what is this Nikshay Poshan Yojana? It is related to direct benefit transfer. So see, earlier, no, for TB patients, this DBT was of rupees 500. Now the amount is increased to 1000. Okay, so we can say that because of these things, the positive growth was seen in TB related cases. Sorry, positive growth in the no health condition of TB patients in India. Okay, so because of these all things. Now, we will discuss that why this target was missed. What were the reasons? Okay, so no, this is very relevant section that why target was missed. So first of the important reason is drug resistant TB. Okay, drug resistant TB, that is MDR TB and XDR TB. So what do I mean by drug resistant TB? See, for example, this is drug 1, this is drug 2 and this is my bacteria. Okay, now when a condition is no achieved that there is no effect of these two drugs on this bacteria, then this drug can be said to be the resistant for these two drugs. So in this way you can say that multi-drug resistant TB is a form of TB that is resistant to basically two kind of drugs. Okay, so in definition basically two kind of drugs are mentioned. So first is isoniazid and second is rifampicin. So any drug which is resistant to these, any microbacteria which is resistant to these two drugs, so it for that microorganism we can say multi-drug resistant TB. Okay. So this is very important thing. Why it is very important thing that because of this multi-drug resistant, no, the treatment gets longer and longer. For example, the treatments can even extend to 24 months. That is 2 years. Okay, and treatment can get expensive also because of this multi-drug resistance. Okay, now comes the second point that is supply chain gaps and drug stocks. So basically, the here issue is that no various states report the drug shortages. Okay, and because and no the person who is facing this issue of TB, even if he misses one or two doses, it can be very fatal. Okay, so this is the issue with the drug stocks and supply chain. Now coming to infrastructure and workforce challenges. So what is the thing here? See, actually in rural and tribal regions, there is limited diagnostic access. Okay, I think you all are aware of this in these kind of regions. Okay, and in tribal regions or rural regions, there is shortage of trained staff also. Okay, so because of this, no, the detection gets delayed. And if detection gets delayed, so the elimination goal will not be achieved. Right. Next comes the funding gaps. So, what is the issue with funding gaps? What is the issue with funding? See, actually, see, this data is very important. I'm writing here that globally, if we want to eliminate TB, no, so yearly we need $22 billion amount. Okay, but currently, report talks about 2024, we have only around $5.9 billion, or basically you can say $6 billion amount. Requirement is this, and this we actually have. Okay, second most important thing is that if we want to do more research on this type of bacteria, no, so what is globally we have set a target that no $5 billion amount will be no set aside for research and development, but actually the amount we have is around only $1.2 billion. So now, easily you can see the funding gap, right? This is the gap. This is the gap in the research and development, in the funding overall, no disease diagnosis and detection. Okay. Now, very important another point, that is social stigma. Social stigma. Okay. See, what is the issue here? So, in social, what is happening? No, that this stigma is especially in no women, or it is in migrant workers also, and in tribal population also. So, because of this stigma, no, the people start to hide their symptoms. Okay, they start to hide their symptoms. Also, they discontinue the treatment because of this stigma, and no even they face discrimination in their families also. Okay, so because of this social stigma, no, their treatment no can no longer continue. So this is the issue. So because of these all issues, we can say that India missed its target of 2025. Okay, now, let's discuss global efforts and India's role. So, this you can include in positive point only, that no uh, globally the TB incidence fell by 2% between 2023 and 24, but the decline in India was twice. Okay, so 2 points you can include. That no, from 2015, India saw steepest decline of 21%, and this thing also you can include, that from 23 to 24, globally the disease incidence fell by 2%, but in India it was around twice. So this is very good. Okay, now, yes, let's discuss the way forward. Means what all needs to be done. Okay, so these points are very important for GS paper 2 and 3. I think we discussed the importance also in starting. Okay, so first point is the universal and equitable access. So what do I mean by this universal and equitable access? That means you have to prioritize the high risk groups. Okay, so what all person comes in high risk groups? See, HIV patients. Okay, the tribal communities, the migrant population. Okay, or the malnourished children. So these all are the no high risk groups. So you have to focus on these groups. Second comes the primary health integration. Primary health integration means in the daily routine or daily checkups, you should include TB as a component. Okay. For example, if you are doing maternal health checkup. Okay, for example, if you are doing HIV diagnosis or HIV treatment, okay, or for example, if you are conducting nutrition related programs. So, in all these programs include TB as a component. Okay. Now, coming to third point, that is scaling up the technology. Scaling up the technology, see, technology we already discussed, right? We discussed about the X-rays, we discussed about the use of AI. So you have to scale that. Okay. For example, you can no, for example, e-Nikshay digital platform. See, it is already available there, e-Nikshay digital platform, but you need to upgrade that. Okay. So these kind of examples you can give. Now coming to strengthening supply chain, as we discussed, no, that there is no issue of stock. So you have to strengthen the drug supply chain. So for example, you can use AI for the no predictive analysis. So AI can predict that when is the requirement of stock. Okay, and there is the need of decentralized storage. Okay, decentralized storage to prevent the stockouts. Okay, and very important thing, more funding for R&D, as we already discussed that there is funding gap, right? So if good more vaccines can be promoted, cheaper diagnosis can be promoted. Okay, through this funding. And the last thing is the community-led stigma reduction. So, no, many groups can be made, civil societies can be included, storytelling sessions can be done, okay, counseling can be done. So, these all things are important to deal with the issue of stigma. Okay, now comes the conclusion. So, see, in conclusion, no, for any answer on health or TB, please remember these keywords that no, India requires innovation, funding, community participation, and systematic reform. Okay, so innovation, funding, community participation, and systematic reform. Okay, so please remember these four letters, and on any answer of health you can put. Okay, so basically it says, conclusion says that though India has no seen steepest decline in TB incidence, but still a lot has to be done. Okay, and the World Health Organization report says to meet the goal of TB elimination, India must sustain annual declines of 10 to 12%. So annually, India should show the decline of 10 to 12%. Then only India can reach its goal to eliminate TB. Okay, so this was the whole article of TB, and please focus on all the points and all the data which we have discussed. This alone article, this alone discussion, you can write in your answer. Nothing extra is needed. Okay. Now coming to no prelims article, that is GPS spoofing. So see, basically what is happening here, no? Several aircrafts have experienced this GPS spoofing because of which their navigation signals are no manipulated. So let's discuss about GPS spoofing. So no, first of all, let's discuss what is spoofing. So see, I will explain. For example, this is you, this is person A, and no, this is pilot. Okay, now this pilot is receiving the genuine signals. Okay, but when the spoofing attack occurs, no, so no various manipulated signals will come, and these signals will over a period of time overcome these genuine signals. So this pilot will think that okay, these are the genuine signals, so I will follow this direction. Okay, because these are genuine signals. But over a period of time, this aeroplane will get manipulated and sorry, this pilot will get manipulated and the aeroplane will go off course. So this is the spoofing attack on airplanes. So basically, this is spoofing is category of cyber attack in which a person thinks that information is coming from the trusted source, but actually it is not coming from the trusted source. Okay, so this is the spoofing. Now coming to GPS spoofing. See, whenever you read the articles, no, somewhere you will get GPS spoofing and somewhere you will get GNSS spoofing. So see, please don't confuse. One will say GPS, one will say GNSS. So basically, GNSS stands for Global Navigation Satellite System, and you can consider it as consider not it is an umbrella term. So GNSS comprises of various global positioning systems. For example, GPS is of USA, Galileo is of European Union, IRNSS is of India. So it is an umbrella term. So it comprises all these positioning systems. Okay, so please then don't confuse. These both are same things only. Now, let's discuss about the GPS spoofing. So, as we already discussed with example, no, see, actually, spoofing is a kind of cyber attack, right? So, what is the main motive? The intent will be malicious only. Main motive will be to manipulate the navigation data. Okay. Now, see, one more thing is about the jamming. What is jamming? In jamming, no, GPS signals are completely blocked. But in spoofing, they are not blocked, but the signals will become fake. They won't be genuine. Okay. So the aircraft navigation system will pick up these counterfeit signals. As we discussed, no, earlier there were genuine signals over a period of time. These counterfeit signals will be picked up by the aircraft, and based on these counterfeit signals, everything wrong will be calculated. All the calculations will go wrong. Directions will also go wrong. Okay, so this is only discussed. And what is the aim of a GPS spoofing? Its aim is to provide the false navigation system so that the aircraft can go off course. Okay, so this is the thing about the GPS spoofing. Now, coming to next article, that is e-Jagrati. So, the context is not much important. Let's discuss e-Jagrati uh, from prelims point of view. So, what is e-Jagrati? Actually, it is a grievance redressal platform. Okay, grievance redressal platform for the consumers under the Department of Consumer Affairs. And uh, the very important point is it will integrate all consumer related dispute resolution system in one portal only. Okay, so this is very important point for GS paper 2, that is for governance. Okay, and which organization is involved? So it is obvious that no Ministry of Consumer Affairs only will be involved. Okay, now coming to the aim. So aim, no, it is very obvious that no faster, transparent consumer justice across India. And important thing here is that it will be for NRIs also across India and abroad. So please focus on this point across India and abroad. Okay. Now, let's know key features are also given in the article. So we won't be discussing in detail because they are not much important from prelims point of view. Let's discuss briefly what are the key features of e-Jagrati. So first is unified paperless consumer codes. So there is provision of consumer codes only. Okay. So where no electronic notices can be given, virtual hearings can be done, these all things. Okay. Important thing here is global accessibility for NRIs. Okay, so the people who are abroad, no, they can easily file, track, and participate in hearings. Okay, so this is important thing. Next is AI powered multilingual interface. So multilingual interface like no, so there will be AI powered no, so there will be chatbot assistance, there will be voice to text recognition tools, these all things. So because of these things, no, even no elderly and visually impaired users can get the justice. So this is important. And last is the secure fee payments. So secure payments means various kind of platforms can be used like no, it will support Pay, GOV, Bharat Kosh, etc. So these are the features of e-Jagrati. Now coming to next article, that is National Press Day 2025. Okay, so first of all, you must remember the date that on 16th November, National Press Day is celebrated. Now, next important point for prelims is why National Press Day is celebrated on 16th of November. So this is very important that why it was celebrated. So it was celebrated to commemorate the establishment of Press Council of India. Okay, so on this PCI was established in 1966. So because of this reason, National Press Day is celebrated on 16th of November. Okay, so if we have talked about Press Council of India, then we must discuss about prelims related points also. Okay, so Press Council of India. So first of all, you have to remember very, very important point that it is a statutory body. Okay, statutory body which was established in 1966. Okay, and who recommended the formation of this body? So it was first Press Council only. Okay, and what is the main of this council? See, main is very obvious to preserve the freedom of press. Okay, and improve the standards of press in India. So this is the main aim. But in 1978, another Press Council Act came, and no, it took over the previous act under the original act under which this body was formed. Okay. Now, the chairperson of Press Council of India is selected by a committee which includes Speaker of Lok Sabha, Chairman of Rajya Sabha, and one of the member which is elected by Press Council of India only. Okay. Now, important point here is the decision of Press Council of India are final. This is very important. And they cannot be appealed before court of law. This is very important thing. Okay. Now, coming to limitations of PCI. So, see, these are also important for prelims because a limitation says they cannot penalize newspapers. Okay. News agencies, editors, and journalists for violation of guidelines. Okay. So, they cannot penalize. Second thing is PCI only overviews the functioning of print media. Only print media comes under its jurisdiction. It can, only print media. Okay. And it does not have the power to review the functioning of electronic media. Okay. So only print media and no electronic media. Okay. In this way, you can remember electronic media. Only print media, no electronic media. Okay. Now, coming to a last topic that is exercise Garuna 25. So, see, whenever any exercise comes in news, no, so please remember 3, 4 points based on which UPSC asks questions on these military exercises. Okay, so first of all, I will show you one PYQ, then I will discuss the article, then you will understand that which all points you have to remember. See, this is the PYQ. So the question was asked on exercise Mitra Shakti 2023. Okay, so 4 points were asked that it was conducted between which countries, okay, location was asked, okay, it commenced at which place, aim was asked, okay, and the bodies were asked that which bodies are involved or which forces are involved, okay. So basically, four things were asked. Which countries were involved, what was the location, what was the aim, and which forces were involved. Okay, now let's read. So, Indian Air Force, that means which force it is among the which forces? It is among the air forces. Is participating in the 8th edition of Garuna 25 and it will happen in France. So this is the location. It will happen in France. Okay, so let's discuss prelims related points. So what is Garuna exercise? It is bilateral air exercise. Okay, and it is between which countries? India and France. Okay, and it is among the highest level air force exercises India conducts with foreign air force. Okay, but this is more important. It is held alternately in India and France. Okay, and objectives, so you cannot go on objectives. It includes no mutual operational capabilities, sharing tactics, building log operational familiarity. So these are very obvious things. Please focus on these points. Okay. Now about the 2025 edition. So see, it was 8th edition and it was held in France. Okay. So please remember this. So basically what we discussed, what are the countries? India and France. What is the location? France. And you can, no, see, not important. You have to remember this because if you were aware of this point only, no, that it was between which countries, you can easily get the answer because here the answer is D. So it's not important that you have to remember the difficult name of the place also. Okay. So countries done, location done, aim done, and forces were air forces. So in this way, you should focus on prelims related aspects only. Okay, so that's all for the discussion. We shall meet in next video. Thank you.